All right, we'll move into our 8:35 COVID update with Public Health Director Kathy McKay. And Jamie, good morning.
Good morning, Mr. Chair and Commissioners. We did give you the handout with our latest COVID data for this week. And as you look at the cases, we're still, of course, stable with our cases. It fluctuates up and down. We have 7,152 cumulative cases. The active cases this week are 124. They were 90 last week, but the week before they were 120. So they'll fluctuate within those time frames depending on who is out of isolation. And then the new cases, we have 89 deaths. That was reported for this week, and that did not increase since last week. The number of deaths went up just a little bit across the state of Minnesota, but not a huge number. And then we have the numbers of ICU and those in Clay County and those in Minnesota. So the hospitalizations and ICU rates are really, again, stable. There's not a increase in those. 14-day case rate is, last week it was 25.96, and this week it's 24.84, so went down a little bit, so it's not continuing to increase. We'll see this spring, of course, this will be fluid as we watch the numbers based on events and spring break, those kinds of things. So we'll see how those affect our daily case rates and our 14-day case rate. Our active case by age, again, this is just based on our active cases. So you can see the highest this week has been the 15 to 19 and the 20 to 24-year-olds. So those have topped out for this week. Our cumulative cases by age, pretty consistent across the spectrum, but the 20 to 24 have been the highest cumulative cases by age lately. And then the Clay County hospitalizations per week, so you can see the graph that shows number of admissions and, really had spiked in October, November, December, but has been consistently down for this the spring. And then the deaths, we've talked about that already, that has been not a huge increase. The hospitalization ICU graph is in there as well, so total hospitalizations and ICU admissions, again, remains stable across Clay County and across the state. And then, I guess, Jamie, will go into the vaccination.
I just wanted to note of these active numbers for the 60-plus population, we're only showing 10 active cases. Mm-hmm. That's a pretty good, that must be a sign that the vaccine is doing its thing.
Yeah.
Out of 124 total, there's only 10 that are 60 plus.
Yep, that's really good.
Okay.
Okay, so then the next page, the vaccine administration and distribution data. The total number of people with at least one dose of vaccine in Clay County is at 22.7% and 25.7% for the state of Minnesota. Total number of people with the completed vaccine series, 12.2% in Clay County, 15.3% in Minnesota. People aged 50 to 64 with at least one dose, 35.1% in Clay County, 28.9% in Minnesota. And the people aged 65 plus with at least one dose of vaccine in Clay County, 70.4% and 78.9% in Minnesota. And then you can see the total vaccine administered just by Clay County in the bottom, 8,960 doses. And I believe this is our 12th week of vaccinating. On the graph down there at the bottom, you can see we gave 1,175 doses last week. We continue to vaccinate typically on Tuesdays, Wednesdays, and Thursdays, and we're doing the same this week. And We will be administering 975 doses this week. Again, our clinics are Tuesday, Wednesday, and Thursday. We have moved to where last week we invited a lot of what's considered the food processing and food manufacturing businesses, and then continue to invite anyone in Phase 1A, of course, and anyone 65 and greater as well. And then the population of the 45 to 64 with one or more underlying medical conditions, population 18 to 44 with two or more underlying medical conditions, and then people age 50 years and older in multi-generational housing. And again, we're just posting that on the website for people to register, and continuing to reach out to businesses to say, we want to encourage you to have your employees sign up and be vaccinated. The next phase is to move in, which we don't have permission from the state to move into the phase or 1C, which is more essential workers in that group, and then general, and then eventually we'll get to 2, which is the general population, and we don't have a timeline for that at this point.
The challenge will be, as we see across the river, you know, you probably saw in the news, they now have eliminated their mask mandate, and also that they are moving into the general population next week. So they're, you know, quite a bit ahead of us in regards to the phases. They talked about the western part of the state has been waiting to move to general population, so they've been kind of stagnant. So that will be a challenge for us, as we are not directed to move to the general population yet. So maybe a challenge as we, you know, as we work across the border.
Where are we with our county staff? Where do they fall into place with these different phases? I know we've had some that have received it when you come, you know, with the first responders and our jailers and that type of thing, but how about the rest of our county staff?
Yeah, those have been in direct contact on a regular basis. So the jailers, the juvenile detention, detox, those have all been vaccinated. And the rest of the county staff, it's dependent upon the phase we're in. So, you know, we're working with those individuals if there's departments that meet the criteria. So we're working directly with those departments. But generally, overall,
so we have, I mean, we have some people that end up going into people's homes, and I'm hoping that they're considered essential from a standpoint of having the opportunity to have the vaccine.
Right, right.
Well,
Yeah.
what we can tell you is that, as you know, we have to use all the vaccine in a vial, and so we do
Right.
have a list from county departments and throughout the community that we've said if we have an extra dose. So at the end of a shift, we really work hard
You
to
can push
who's
that.
available, who can come in. So we never leave a dose in a bottle.
And I hope we've got a list of our employees who might be interested in that for that opportunity if it comes up too, so.
Yeah, we usually have a fair number of people that have contacted us
Good.
that are interested, so.
Yes.
Yep, the food workers that you're dealing with now, would that include retail grocery clerks, restaurants, bars, all of those?
Gas stations that prepare food.
So any of our constituents that ask, we just refer them to the county website and schedule an appointment.
Right, and we've reached out to many of those as well, all the grocery stores. Surprisingly, we didn't have a flood of people that were coming in, so we were a bit surprised about that. And all of our manufacturing plants, we reached out directly to them, so they're pretty aware of, we gave them a direct link to register. So some of the larger facilities in our community are well vaccinated, so they may have received the vaccine at other places as well, but we've certainly reached out to them.
Thank you.
The Johnson & Johnson, are you getting much of that here?
You know, we keep asking for the Johnson & Johnson just because that would be easy for some of our particularly homebound individuals or going into some of the long-term care facilities if they have new staff or new residents, they've been fully vaccinated, but, as new people come in, they need the vaccine. So I think the Johnson & Johnson would be ideal. In Minnesota, Public Health is not receiving Johnson & Johnson yet, despite our requests. It's going to healthcare providers, so we continue to request that for those facilities. Even when we look at the inmates in our correctional facilities, Johnson & Johnson would be ideal, so they don't have to wait for a second dose, or maybe they might be out of that facility by the time we get a second dose. So we're still waiting. It's not been available to us yet.
Well, there's a certain population that might be hard to track down for a second one, and so that's the.
Right, we found that with our homeless population. They're pretty transient, so when the second dose comes available, they're not there.
I guess I don't understand why public health wouldn't be a big benefactor in getting the Johnson & Johnson for that reason.
I guess I got the same question. I mean, you go right across the river, they got Johnson & Johnson, and it doesn't seem, they couldn't have dropped off some of them here, but I mean,
Right.
I don't know how the distribution goes. I mean, it just,
There is a very small amount that is being distributed to public health in Minnesota. It's a very small amount, and I believe maybe there was a couple of hundred that came into our region at all. And they're saying that they will rotate that, but it's a very small amount coming to public health. But it is coming into Minnesota.
It's coming to Minnesota, but mostly to healthcare providers. So we continue to ask for it. We make the request, but we'll see when they decide they can.
I guess my final thing on this whole deal is I'm curious, as you were, Kathy, and you're mentioning about what's going to happen with spring break coming with, I remember it was the last time we saw a spike, and you can look at the graphs and you can look to August, and you can see when the students came back, they brought it with them.
Right.
And I'm hoping they're not going to bring it back with them again when they, and I don't mean to pick on them, but
Right.
but when I see the stories about what's going on in Miami, and there's thousands and thousands and thousands of them almost on each other's shoulders,
Yeah,
they're all going to go home.
that's right. And then we have Easter, so
Right.
it'll be another
yeah.
break.
So I hopefully will monitor that closely, and
Yeah, unfortunately with the, the college age, they're not in the priority group right now, so that's a challenge. Other questions? Okay, well, thank you very much.
thank you for your report.